morning, Julio Garcia from Springhill Medical Center's Center for Wound Care and Hyperbaric Medicine joins us on Studio 10. Good to see you again.
Good morning. How you doing?
Good. How you doing?
I'm hanging in there. We're working well and trying to keep busy.
Hanging in there, keeping busy. Sounds good. Today we're talking about how to prevent carbon monoxide poisoning. But before we talk about that, let's just start with what is carbon monoxide?
Carbon monoxide is a byproduct of any combustion. It's a gas. It's odorless, colorless, tasteless. That's what makes it so dangerous, and it can have very detrimental effects to the human body.
This is especially dangerous in our area because of the people's use of generators during severe storms like hurricanes. Can you talk about how these things tie in together with carbon monoxide poisoning?
During Hurricane Katrina in 2005, in the first 3 days, we treated over 30 victims of carbon monoxide poisoning with hyperbarics. What we found in working with the study post-Katrina with CDC is that they're cluster events because families usually gather in a single room, use air conditioning to help cool the room, and then the fumes are being pulled in from the generator by the air conditioner into the room. So you have multiple families getting affected by generator usage and potential deaths.
That's very scary. So let's talk about how these families can play it safe with generators and just in general when it comes to carbon monoxide.
Well, what we found was that typically you're safe if you can keep the the generator at least 25 feet from some type of entrance source into the house, some type of ventilation entrance such as a window or doors or even a vent. Like some people would like to put it in a garage or maybe a storage room. Well, they could still come in through the vents into the house. Carbon monoxide can. The single best way to be able to tell, though, is to purchase at your local hardware store, Lowe's, Home Depot, a battery-operated carbon monoxide monitor. And the reason you want it battery-operated is because you're going to lose power, so that makes the best sense. Fire departments will tell you that you want to change the batteries in the fall for your carbon monoxides and in the spring for your fire detectors. So it's a good habit to get into your smoke detectors inside the house.
And it's ridiculously cheap for how
Absolutely.
safe.
I think the average cost of them are around $20–25.
Right.
And, versus your life, I think that's fairly reasonable.
That's a good point. Lastly, though, let's talk about, if people do start to see some symptoms, worst case scenario, what symptoms can they see of carbon monoxide?
Well, that's unfortunately, they're very open-ended. It can be headache, dizziness, fatigue, general fatigue, confusion. So you can see that they can be very subtle in their effects, and all of a sudden the patient becomes overcome by the carbon monoxide. Loss of consciousness can lead to death. The real danger from it comes from long-term damage to the brain, because essentially you're drowning or you're not getting any oxygen to your body because the red blood cells are bound now with the carbon monoxide. So even though you're breathing, your body is not getting the oxygen it needs, and that causes permanent damage to the brain, or potentially permanent damage to the brain, and that's what makes it so scary.
So the main two things we want to take away from this are the prevention techniques, which is one, keep your generator far away.
25 feet at minimum.
25 feet, and purchase a carbon monoxide alarm if you haven't already. If you have any more questions, you can always contact Springhill Medical Center or Julio Garcia. Thank you so much for joining us.
You're welcome. Thanks for seeing me again.
Appreciate it.